Well, good afternoon, everybody. I'm Eric Linzer, President and CEO of the New York Health Plan Association. Welcome to today's webinar, From Data Governance to Data Integrity, the Value in Building Trust in Your Data. This is one of the many webinars and forums HPA hosts to keep our members up to date on issues affecting our industry. So thank you for taking the time to be with us today. And a special thank you to our friends at Impressive Health, an HPA affiliate member, for sponsoring today's session. Now, according to the PwC Research Institute, 60% of healthcare executives say they cannot rely on their own data for strategic decision-making. Today's webinar will explore the critical topic of healthcare data governance and discuss approaches for addressing common challenges, including data silos, quality issues, and security risks, along with strategies to overcome these hurdles. Joining us is Marcus Fontaine, founder and CEO of Impressive Health, which focuses on efforts to enhance the efficiency, compliance, and technology service needs of healthcare organizations across the nation. Before founding Impressive Health, Marcus built a strong background working with a variety of healthcare consulting firms such as High Point Solutions and Sutter Health, among others. We also have three members of the Impressive Health Executive Advisory Board joining us, including Dr. Jerry Osband, the former Chief Medical Officer for EXL, Dr. Mary Davis, the former Chief Medical Officer for both Baylor Scott and White Health Plan and Security Health Plan, and Joe Odo, the former CIO of TriWest Healthcare. Now, before I turn the session over to Marcus, we wanted to let you know that there will be an opportunity for Q&A throughout today's fireside chat. This is an interactive session, so if you wish to submit a question, just enter it at the bottom of the screen in the Q&A function. Now, during today's session, the group will try to get to as many attendee questions as possible, and we are also recording today's session, so we'll be making copies of the presentation as well as a recording of the webinar available following today's session. With that, thank you all again for joining us, and I'll turn the session over to Marcus. Good afternoon, Marcus.
Hi, Eric. Thank you so much for the introduction and look forward to our fireside chat today. Just to give you guys a heads up, as Eric mentioned, who made my job extremely easy to introduce myself and our organization. Today is just going to be a fireside chat style conversation. We look forward to engaging with you guys. So if you have questions, please ask them. And to give you a heads up, in the event there are too many questions, we promise to get back to you as soon as we can right after this session. So let me go ahead and share my screen. Let's see. All right. So can everyone confirm, or Eric, can you confirm that my screen is visible?
I can see it, Marcus.
Awesome. Great. All right. So just to give you guys a reminder, today's discussion is around data governance and talking through the integrity of our data, what it means to have clean and consistent data. And on our call, as Eric mentioned, we have our executive advisory board. I have, Dr. Mary Davis, Dr. Jerry Osband, and Joe Odo. And again, we look forward to having this conversation today. So our agenda for today is first defining our data and what is data governance exactly. Once we talk through defining data governance, we're going to talk through the cost of poor data quality and what that might mean to your organization. We're going to discuss on how to accelerate data governance in a data governance framework. And then at the end of our call, we're going to talk about an ideal future state and what that might look like. And we're going to give you some free advice on how to tee up an ideal data governance structure. So let's talk about data governance. So the first question I have for everybody is, do you actually trust your data in your organization today? And how we look at data governance, we like to do what I call a skydiving model, and starting at 100,000 feet. And at the top level, we have the data governance framework itself. And these are the policies and the procedures that basically inform your organization of how to manage the data from end to end. At the middle level, at about 50,000 feet, we have data management. And the data management is the actual implementation of the data based on the data governance policies that I just mentioned. So if you're going from 100,000 feet to 50,000 feet, then we get into the bells and, the meat and potatoes of data governance, the data integrity. So the question that we like to ask is, how clean is your data and is it accurate? So before we go forward, one of the things I do want to call out at the bottom of this screen and a couple others behind us, we have a polling question. So Arlene, could you do me a favor and kind of read through the first poll for us?
Everyone should see the poll on your screen. Is the data used in your reporting reliable enough to support critical decisions? And there are your choices. I'll give it a few minutes as people enter their responses.
And Arlene, just let me know when I can go forward, please. Okay. All right. So at the highest level, we have a data governance framework. We talk through at the high level what data management is. We talk through data integrity, which is the cleanliness of your data. So an example would be in your care management solutions in your core claim system. How accurate are the data attributes that you receive in your enrollment file? How accurate is the data that your end user are inputting into those systems? And as I ask, folks across the country, do you trust in your data? It's very common to hear no. And no is more common than you think. So what we hear is, our systems are fragmented. We're not collecting, accurate data on our UAS file. Once a member is enrolled into our organization, we're having data overwritten because we don't have the right policy and procedures in place. And, one of the statistics that Eric just shared with us is that 60% of healthcare executives say that they cannot rely on their own data to make strategic decisions. In addition to that, an alarming statistic that we found was health plans are losing on average of a little over 17 million a year because of poor data integration and reporting inefficiencies. So, I always like to ask the question, do you trust in your data and are you pulling accurate reports? So before we move on to our panelists, I actually have one more question to ask everyone before we go forward in the conversation. So Arlene, could you do me a favor and share the second poll question before we move forward? All right, so Arlene, I don't know if you're on mute, but I'll go ahead and ask the question. So how would you guys describe your organization's current data governance setup? So if you could share those details, is it fully established? Is it in progress? Are there informal efforts? So are some folks practicing and some folks aren't? Or is there nothing at all? So I'll give it a couple seconds, then I'll move on to the next slide.
I think all the results are in, so I
will
go
great.
in this poll.
All right. So what this means is, without clean and accurate data, it really puts your organization at risk. And there's a number of areas that, you guys may experience, whether it's member and provider abrasion. It could, result in financial waste, compliance and security risk. And, unfortunately enough, operational impact where you have unhappy end users, you have leaders who, can't perform their job at the top of their capability. So those are just some of the things that we find without clean and accurate data. So what I want to do is actually turn to Dr. Mary Davis. And Mary, I want to ask you the question. So in your previous life, did you experience any of these? And if so, how did you overcome it?
I'm not sure that I really overcame many things. We had multiple workarounds. We wrote some complicated code, but I have two examples. I have one operational example. We put in a new care management platform, and we didn't talk about data governance in terms of what we would require in terms of reporting from that management platform. And consequently, I couldn't follow a request, a request from its inception through appeal. I could never join the two systems that we had doing first the original decision and then appeals. So I couldn't get good operational data. I couldn't figure out what was wrong with policy. I couldn't understand why and how we could reduce our appeal rate by making the right decision in the first place. So that has huge operational costs, especially when you're talking about medical directors, which are the most expensive people I have on my staff as a health plan executive. The second is a clinical example, and that is we were asked to participate with a national group on continuous glucose monitoring and its impact on our members with diabetes. And as the first data pull, we had to identify who had type 1 and type 2 diabetes. We pulled the data, and 17% or so, 17 to 22%, I think, had a diagnosis of both, which if you're a clinician, you know, is not really possible. You have one or the other type of diabetes. And so that data cleanup took an enormous amount of time, because if you figure the number of diabetics is 5 to 10% of any Medicare population, that's a lot of members that you have to go through and confirm your data. So that's sort of the data cleanliness. So that leads to a lot of waste in terms of both time for staff. And at the end of the day, if we can't identify those members correctly, we can't administer our policy on who should have these devices and who shouldn't. So those are my two most recent examples. I've got many more.
Any financial impact to the organization that you were with, and whether you guys would maximize those revenue opportunities? Was there any financial waste or loss that you could talk to?
So if we don't have accurate diagnostic data or complete diagnostic data for our government programs, we certainly risk leaving money on the table to pay for care related to risk adjustment in both the ACA and in Medicare Advantage. So yeah, there's a big issue around financial losses. That plus the operational inefficiencies, having to go to outside hearings as an enormous cost for the operational end of the organization, because it takes a lot of time and effort that we could spend doing other things that are more member-centric and put us in a better position to get better CAP scores, for instance.
Thank you. So what I want to do based on that note is I want to transition over to the next poll question. Arlene, could you share that with the group, please?
Oh, the poll question is, if your organization has a data governance structure in place, how effective do you find it? Extremely effective, somewhat effective, not very effective, not effective at all, or we don't have a data governance structure in place. Okay, responses are coming in.
So Mary, while the results are coming in, can I ask you the question, and you don't have to speak to the organization name, but in the latest organization, did you guys practice data governance, even at a lower level, or were you guys fully mature?
So we were not fully mature. And we had a struggle because we were provider-owned plan with having data governance at the system level and then missing a layer at the plan level. So it was complex because data governance means different things to different people. And so the clinical enterprise focused on the clinical data and the financial data that they had, but there was little or no emphasis at the plan level to both learn what we could from their data governance and put in place a level of data governance for our organization specifically.
Appreciate it. So this is actually a great segue to the next slide that we have here. And, this is something that our team put together. What if my organization is at risk? What does that mean for me? We just kind of, threw a couple of those risks on the wall. And these are some things that you guys may have experienced in the past, whether your current organization or your previous organization. But, when you have bad data, what it causes is, operational inefficiencies, inaccuracy when it comes to HCC and risk adjustment, clinical errors, manual workarounds, and the list goes on. So before we get to our poll question, I actually want to turn to Dr. Jerry. Dr. Jerry, kind of want to put you on the spot here and ask you the question. If you were experiencing one or a couple of the issues that we see on our screen here, how would you approach it, right? Like, what would you do? How would you get to an outcome of resolving one, if not all, if you want to try to eat the elephant in one sitting, as they say? Can you talk to that for me and maybe what you've done in a previous life?
Sure. Thanks, Marcus, and good afternoon, everybody. As you can see from this slide, there's a number of areas where data issues create risk for an organization, and there's lots of challenges and opportunities to potentially address. So as you mentioned, the big question is, where do you start? And how do you create within an organization a hierarchy of impact? So here are some suggestions based on my experience in working with Impressive as well. The first priority is addressing data management. So the initial step is defining a process for the acquisition and aggregation of essential data to be used in operational and clinical activities. Without a plan to ensure data quality, intake, and oversight, it'll be very difficult to resolve the problems and the risks noted. So that initial data acquisition and aggregation reviews really sets the stage for further priority objectives. Second, identify and stratify priorities for data governance. In other words, using internal and consultative reviews, focus on the most relevant and addressable risks. And these are individual for each organization. So one size may not fit all. And it's good to get some external input to help you define those priorities. So these risks can be divided into categories of people, process, technology, and they can be used for clinical, financial, and operational short and long-term impact. So the review of people, process, and technology involving data governance is a crucial second step in avoiding these risks. As I look at the third priority step is really organizational involvement and engagement of senior management. This requires a management commitment that once priorities have been identified by the teams, resources will be budgeted and applied to well-timed projects for completion. This is an area, again, where a consultative contribution of project management skills can help with organizational communication and planning, as well as refining resource requirements, establishing timeframes, and setting success factor development. So project management of people, process, and technology can be an internal organizational challenge. This can be supported by including external expertise to avoid overloading your daily business and operational requirements. Because once you get into these project plans, people have their daily jobs to do, and they need to be supported so they can do both the work required of them, as well as taking on these new and exciting opportunities. The final step in managing these risks is to develop a strong set of reporting capabilities. There should be considerations of the key metrics of success for each project being initiated. So risk reduction needs to demonstrate the clinical, quality, and operational needs that provide the kinds of outcomes that show a true ROI on the benefit of the proposed project plan. Adding key performance indicators will show adherence to continuous quality improvements as well. So based on my experience and in working with Impressive Health, I've learned that if you focus on priorities of data acquisition and aggregation, the identification and stratification of achievable projects, the right kind of organizational engagement, and strong reporting strategies, you can really set the best outcomes for defining those risks that matter most to your organization. So thanks, Marcus.
Thanks, Dr. Jerry. So that was great. So what I want to do is get to the next poll question. It really helps us out as we kind of gear up for the next stage of the call. So Arlene, could you do me a favor and share the question for the slide, please?
Question for this poll is, do any of these challenges sound familiar in your organization today? Yes or no?
And Dr. Jerry, before we move on to the next slide, I want to ask you a question. I know you've been engaged with us in a couple of different environments, a couple of different health plans, some of which, I think some of them are on the call today in terms of some of the stakeholders that we've worked with. But how often have you worked outside of the clinical team? I mean, are you often asked to engage, with the tech team, with the BI analytics group? Can you talk through that for us really quick?
Sure. Most frequently, it's really getting involved with the analytics team. So helping in terms of getting the data to the right analytics groups, helping them again with the identification and stratification of those individuals and populations at the greatest risk for a clinical or financial adverse event, helping identify where you can best enroll those members and populations, engage them effectively, and then report on results. So for me, most frequently, it falls into the analytics area. But also in regards to that, it's very important to understand what kind of technology is going to be evaluated, applied, implemented, and then used to do the clinical management as well as the analytics. So I'd say the second area where I've been involved is really in that evaluation of the technology that's going to be most beneficial within care management and the analytics area.
Thank you for that. I appreciate it. So depending on where you sit in your organization, depending on the maturity level, which you guys are practicing data governance, you're likely thinking one of these two questions, right? So what now, and how do we move forward? So typically when we're in, a boardroom or we're having a conversation with someone who might be kind of feeling the pains of data, the first step is, let's identify gaps and opportunities to improve. And we start small. And we typically start small within one particular domain, whether it's, within care management, whether it's in claims. And if it's in care management, starting, getting more granular, maybe it's, attributes related to the member record. Maybe it's attributes related to the provider record. So just an approach that we'll talk through in just a bit. And then the question of how do we move forward? And really the answer becomes it's building the case to implement a data governance framework. And building a case, whether you sit in IT, whether you sit in finance, whether you sit in medical management, likely it's building the case to the organization that this is something that we need to move forward with. And once you do that, you really start thinking about what's the ideal future state, and I like to call it data nirvana. What does the perfect world look like? And what we like to provide is a little bit of call it a pathway to data governance. So there's three key areas that, become your North Star. And the first one is having a fully functioning, enterprise data warehouse. And yes, it's 2025. You would think that most organizations have a fully functioning EDW with, let's call it functions of in place to where it cleans and stratifies data, it scrubs it, and it puts the perfect data attribute in your EDW, so you can pull it whenever you need it. However, that is in the perfect world that you have a centralized data repository. As a next step, you want to improve your overall data quality. This just increases, productivity and performance across the board. An example of improved data quality is something as simple as, I am an MLTC in New York State, and I have a member that, they're jumping from plan to plan. And every 6 months they have a new address, right? So what's the latest address? What's the newest address? What is accurate? What isn't accurate? What policy and procedures do you have in place to make sure that you have accurate and reliable data based on that one member profile? And I would say what I hear the most, whether it's in New York, whether it's in California, it doesn't matter. What I hear the most is, we want self-service analytics and reporting. This is what would make the organization extremely efficient, right? So, we want to create planned data that the end user can get at any point that they need it and pull the data that they need. So, I need a readmit within the last 30 days of these diagnoses. I want to see what a caseload is for this particular team in a snap of a finger. So that's what we call the ideal future state. And what we want to talk through now is just the path to get you there. So before we go, remind me, Arlene, have we shared the poll for this slide yet? I don't think we have.
Oh, I will do it right now.
All right, thank you.
And the question is, are your current data practices aligned with where your organization wants to be? Yes or no? Give it one more second, and I will end the poll now.
Thank you. All right, so we've talked through the perfect world of data governance. We've talked through, what would an improved data integrity, look like from our organization? What would it look like if I could, get to the ideal state? Well, what we wanted to provide is a cheat sheet to accelerate the path to get there, to build your business case of pushing a data governance framework within your organization. So, to that end, I think the person who is best suited to talk to this is Joe Odo. Joe, you've led, multiple Blues plans. You've worked at one of the largest FEP employers in the country. I know you have worked intimately in the world of data. So I want to pass this over to you and want to start with the question, if you're starting from scratch, you're new to an organization, you've observed that, hey, the data quality isn't the best. We probably have a ways to go to get to that pure nirvana state. I'm giving you 120 days to basically build a business case. Can you talk us through kind of where you start and, what technologies you'd maybe look into to help get you there?
Sure. Thanks, Marcus. Appreciate it. A couple things that I'm going to highlight. And you've heard Marcus, Dr. Mary, and Dr. Jerry talk about their own experience, some of the challenges, and some of the ideal state, and let's call it nirvana, to get to as far as self-service analytics. Now I'm going to talk to how do we get there? First of all, different mindset. So data now is treated as more of a strategic asset. It's a part of the company assets and one of the most valuable, especially for decision making, even improving and driving revenue. So example, you probably do Medicaid quality incentives, do reporting off of it for compliance with state of New York, improve regulatory reporting, reducing errors, avoiding fines, and saving labor, all drive different levers within the organization. So I'm going to go through kind of acceleration, this path to data governance, and a lot of the core fundamentals that you have to have in place. And as you heard from Marcus and others, Impressive Health can help in a lot of these areas to help accelerate the process and lay this core foundation. So first, it helps to build a business case, especially if you want additional funding for the initiative. One way to do that is to lay out how to improve the data quality. There's been a lot of studies up to, some have 70% errors within their data. They don't trust their data. You've seen polls and information on 60% do not trust their data. We'll see how our polls come out at the end here, but that's pretty typical. Another thing, especially in healthcare, we want to reduce compliance risk, especially along compliance regulations like HIPAA, like GDPR in Europe. So that's one. Operational efficiency. So correcting, verifying data so people actually trust and are able to make decisions is critical. And then faster time to insight and decision. So I call it data-driven decision making is where a lot of organizations are going. As decisions speed up and get faster, it's important to have that real-time data available. In a lot of cases, self-service analytics, as Marcus mentioned, is just a critical factor. Other ROI things is data trust, and then improve customer experience. So, consistent customer service is critical to a lot of organizations. So those are some areas that you can build a business case, move to an ROI, and then if you need additional money for initiatives, you can go through a business case with that. The other thing I want to highlight is some of the roles and responsibilities. You may have these within your organization already, you may not. Some have gaps. Again, organization like Impressive Health can fill some of these gaps, but I'm going to go through the different data roles and responsibilities that should be within your organization. So one is a chief data officer or CDO. This person looks at strategy and goal alignment in the organization. The other is, and I'm going to go through a couple quickly, data governance lead and manager. So this person sets the policies and drives adoption of data governance. Data stewards, this is typically looking at data quality and domain metadata for analytics. Data owners, people that have the responsibility, and you probably have some of these, but they may not have the hat or role. People within your business units that will be responsible for completeness and verification of data. Data architects, a lot of people maybe not have one on staff. This is an area you might bring somebody in, but typically these people come in and look at policy enforcement and then align data models, especially within your systems, to what you want to accomplish. And then the other one is business users, analysts, and consumers of the data. These people frequently are reporting feedback and issues with data that can, correct it and verify it and then build trust. So those are some of the key roles and responsibilities. A lot of these you can put together like it shows within 60 to 75 days, but this should be a focus up front. Prioritize the data domains. You can't govern everything at once. You shouldn't try to. So where do you focus for most of the business value and reduction of risk? So that's really critical. I would say start off with aligning business objectives. So if you have a business objective of customer retention as an example, you would focus on the customer data domain to make that trustworthy and really develop that out. Secondly, assess the risk and compliance objectives of your organization. Example is PII or financial records that are sensitive that you want to focus on. Data quality issues. In a lot of cases, there are duplicates or missing values, nulls that need to be cleaned up. This is a focus area from a data quality perspective. And then I'll say this cross-functional impact. So you may have some major value chains within your organization. Example might be customer product data that touches every department. So patient data or member data, you have to be able to focus on that and really drive it through cross-functionally across the organization, across your value chain or processes. So those are some of the those I'd say within the first 90 days to 100 days, you can really make a huge difference within the organization. Next, I'm going to just focus on the creation of policies and standards is critical. You want to build trust in your data, keep it clean and practical. KISS method, okay, for complexity. Really focus on 2 to 3 key policies and drive those home. You got to state a clear purpose, especially within your personal data, how it's stored and processed, like in compliance with HIPAA, as an example, and then create policies. Policies are just rules of the game. the what and why. So quality, is the data complete? Is it valid? Is it consistent? And is it timely, as Marcus mentions, as far as um, timely analytics? Data access and security. What are the privileges for access? Data retention. So do I need to archive this after 7 years, as an example? Some of this is legal compliance. And then data classification. Is this available for the public? Are we going to keep this internal to our organization? Is it confidential? Is it restricted? Okay, so you have to go through that relative to how you want to utilize your data and how you want to govern it. And then define the data standards. So these are naming conventions, data formats, code lists like gender codes, state codes for New York, NY, or AZ for Arizona, for the states. So you don't want to reinvent everything. So in a lot of cases, when you document, which is the next one, document the data requirements, you want to use some help. So I always say, and here's a tip, use an industry healthcare data architecture. So some systems build it in. I'll give a couple examples. So I implemented Salesforce Health Cloud as an example. EXL has it, and Omega for clinical and care management. But you want to have a base of healthcare data. You don't want to just buy a system because it has, nice shiny blue and red buttons. So, and you know better than to do that. So as you expand, you can grow, and the fields will adjust as healthcare changes over time. A lot of them will do software updates, and they'll provide, if there's any new data fields relative to healthcare, Medicare, Medicaid, different fields that you may use, especially in your compliance reporting, as an example. So this is really critical that you look at the healthcare data model. So just a tip there. Some of it is looking at the data types, the formats for data requirements, your source systems, where your source data is from. Is it required field to fill in? Who's the data owner? Things like that. So next, I want to talk a little bit about identifying opportunities for improvement. Two keys, where and how. So how do we get data quality, monitor data quality metrics? There's technology tools to do that. Marcus wanted me to mention some of them. So Informatica, Talend, even SQL can be used to monitor and control data quality. This is where data is critical for completeness, accuracy, timeliness, and elimination of duplicates, which is critical to people trusting the data. Improvements of how. So, I mentioned nulls and key fields. You want to look and update those, especially with your data owners. High duplicate rates, you can look at revisiting some of the matching logic to eliminate duplicates. And then here's another tip for business user feedback. I call it the canary in the coal mine, but just have some feedback sessions where people actually using the data, can say where it's not working. You can even track some of the tickets, which I've done in a previous life with tools like ServiceNow, Slack, or Jira, where people enter a ticket and you investigate, where the data is not synchronized properly. You track your policies, and then the other thing I would recommend going forward is lay a benchmark for data governance. There's some out there. One I've used is Gartner uses a data governance maturity model, so that's a possibility also. Next, create the roadmap. Really assess the current state, and again, you can bring in help on this. Impressive Health helps many organizations do this relative to your governance, your maturity, your quality, data access, security, and then the technology and tools that might make sense for you to automate some of the processes. Define governance goals. How are we going to improve data quality? How are we going to meet compliance, like I mentioned with Medicaid QI, and how are we going to manage risk management? And then identify key initiatives to get you there. So, and then have milestones and timeline, track everything, right? If it's not managed, it just doesn't happen. So automated data quality monitoring is critical. You can maybe set up a data stewardship program to drive improved quality. Compliance and security improvements are important. And then even training and awareness from your organization makes a big difference of people knowing, hey, I need to fill in this field because it's key for people down the road for reporting and analytics. So these are just some of the things. I would also recommend assigning owners to the timeline, and then you want to measure and track your progress. So that's a little bit. And then just in general, from a fundamentals standpoint, I'll give you a top 10, but establish data governance framework. We talked about building it out. Data ownership, critical data quality, data security and privacy, managing your data, metadata management. So it's all about the data, data classification we talked about. So public, private, confidential. Set up your data lifecycle management, how long you're going to retain this data, when you're going to archive, data access policies, data compliance, and then finally, data governance with training and a program to establish your culture. So in summary, we took a poll. Do you trust your data? Really bottom line. Data governance, take a structured approach, manage your data assets. They're critical within your organization. You want to ensure data quality, security, access, and compliance. Again, develop trust in your data for decision-making. And finally, in data, we trust. If you can get to that, you're going well. So I'm going to turn it back to Marcus.
Thanks, Joe. I appreciate it. So, as before I turn it back over to Eric for questions, serendipitously, I saw an email that Eric sent out. Eric, if you can talk through it briefly. I think it was late last week. You mentioned, the state budget. I don't believe it's been finalized. It was to a tune of $300 million for the QI program and incentives for 2026. And, I just found it extremely ironic that, we wanted to put together this webinar, but, in order for, any organization to really strengthen their QI interventions, you really do it through advanced analytics, right? It's being able to get to the data. It's the ability to stratify your data, to identify those QI measures. So, I found this extremely timely, and I'm hoping that you guys can put together a couple of questions before we leave today. So, to that end, we really do appreciate, you guys joining us, and definitely, want you to ask, for help. And we're even going to provide a data governance assessment for, so you guys can see where you kind of stand on a maturity level, if it's high, medium, or low. So Eric, that wraps us up today. If you'd like to close us out.
Sure, happy to do it. Before we wrap up, we thought we would just post the results of the of the survey poll. So as we get those post up, certainly appreciate everybody's feedback. Question one, I think what we saw here, and it demonstrates the need for a webinar like this, that when talking about how, if the data is used in your organization's reporting, is it reliable enough to support clinical decisions? 4 out of the 4 responses indicated that sometimes. And Marcus, I think to your point about our push around the quality incentive program, the need for additional state dollars, that's not just a health plan challenge. It's certainly a challenge for community organizations and for providers, and to be able to make those investments, whether it's investing in helping providers invest in software systems, or other systems such as early notifications out to their patients. All of this goes into, I think, everything that you and the this fireside chat talked about, which is, do I have faith and confidence in my data? So if we move on to this, the rest of the responses, question 2. How would you describe your organization's current data governance setup? And Marcus, I'm sure you see this all the time with the organizations that you work with. Bit of a mixed bag here. two out of the 6 respondents indicated fully established. Half of those respondents said it's in progress. One of them said sort of informal efforts. So, obviously there's a lot more work that groups need to, need to be doing. And I think, based on those responses, the conversation today hopefully was very informative and enlightening for folks who joined us today. As we move to the third out of, I think, 5 poll questions, is if your organization has a data governance structure in place, how effective do you find it? And the responses were either 3 out of 4, 75% indicated not very effective, inconsistent, or siloed execution, which I think goes to the concern that executives have about, do I have the confidence in the data that I have? But if it's siloed or not, or not consistent, I think that's why you see that 60% response rate from the PwC poll. And then 1 out of 4 indicated that they don't have a data governance structure in place. As we move to the last, couple of responses, these were our yes, no response questions. Do any of these challenges sound familiar in your organization today? Nobody said no. So I think there's certainly, a demonstration that, folks are challenged. Organizations recognize the risk, and this is requires continual and ongoing investments. And then as we get to our last one, the ideal future state is, is your organization's current data practices aligned with where the organization wants to be? And for those folks who did respond, they indicated no. So I think it demonstrates that, this is an iterative process. Data governance, reliance on data is a high priority, but at the same time, there's a lot more work that needs to be done. So with that, let me just follow up again by saying that, Marcus, Jerry, Joe, and Mary, thank you so much for today's conversation. This has been enlightening, informative. I hope you all enjoyed the conversation. For folks who took the time to listen in on today's presentation and discussion, hopefully you found it useful, insightful, and as I said at the outset, we'll be sending out a copy of both the slides that Marcus had presented, as well as a recording of today's session, along with a survey, just to get your feedback on both today's conversation and ideas around other opportunities for future webinars. I should have said at the outset where this really came. Today's webinar really came about was for folks who get his regular email. Marcus had put something. Marcus in the group had put out a sort of a call to action email at the beginning of the session, or at the beginning of the year, and that sort of prompted. There's a lot that plans, I think, can take from the work that goes on with Impressive Health. So before we let you go, let me just see if there's any other questions from folks. We do have one from our good friend Gary Balnick, who writes, he's a downstream mail vendor, and one of the consistent challenges he encounters is the accuracy of address data provided by clients. And while they've implemented some programmatic processes to standardize and update addresses, they still see a significant volume of return mail. And this obviously drives cost. He's curious, Marcus, I'll turn this over to you. Does your strategy include solutions specifically targeting address data issues related to mailed communications?
Yep. So that's actually a great question, and thanks for asking that, Gary. Interesting enough, it actually goes back to the example that I shared earlier, where a use case is that typically, a member will have address 1, in January. They move 3 to 5 times, before the end of the year, and what we don't think about is the downstream impact. If I heard you phrase it correctly too, with Gary being an external vendor, and Command Direct, they're heavily tied into several different health plans in New York already. So being a correspondence vendor and it being extremely important, I would put that as one of the top domains to focus on, as Joe Oda mentioned earlier. Anything surrounding the member record, name, address, you would definitely want, clean and scrubbed for that very use case. So Gary, great question. And yes, you're absolutely right that, strategically that would need to be a priority for any plan to make sure they have the member demographics, as clean as possible.
I'll add to Marcus. So there are solutions that we've implemented. One is to go out and check addressing to make sure it's validated, and you go out to public addressing sites to do that, even government sites. The other is, a lot of people, elderly, they may move in the summer to Phoenix, Arizona, and they may be in the north or east during the rest of the year. So people use different addresses, and there's accommodation to do that in solutions also. So there's ways around it to improve quality of the information.
Thanks, Joe.
Any other questions before we wrap things up today? Well, if not, again, I just want to thank Marcus and all of you for joining us. We want to thank Impressive Health for for today's session. I hope for all of our attendees, you found today's discussion insightful and informative. As I mentioned, we'll be sending out today's presentation, a link to the discussion and an evaluation form. So certainly give us feedback on today's webinar and any suggestions for future programs. With that, thank you all again for taking the time out of your busy schedules to join us. And I hope you have a great rest of your week. Thanks, everybody.
Thank you, Eric, and thank you, everybody.
Thank you.